You may remember Lei, who told her story in another video about how ultrasound examinations of her breasts were reported as having no sign of cancer when her breast was actually harboring a malignant tumor larger than 4 centimeters in size. How is this possible? In this video, I am going to explain the relevant medical aspects. I will give a very brief discourse on how doctors interpret ultrasound breast findings. Of course, the ideal situation would be that an ultrasound examination show normal breast tissue, as it is in this image. However, there are occasions when the ultrasound study shows some changes, or what doctors may term as lesions in the breast. If this is the case, there is usually a darker area referred to as a hypoechoic lesion. As you see, this area is oval in shape with the longer axis laid out in a horizontal position, making it wider than tall. The margins are smooth. This lesion is very likely benign. Doctors will usually recommend monitoring such findings for growth and changes in characteristics rather than performing a biopsy when we encounter such findings. In this other case, we can see that the lesion is darker than the other one. It appears taller than wide, and the margins are very irregular. This lesion has a very high chance of being cancer. But not all lesions will follow the expected textbook appearance on ultrasound, and that is why we have to correlate the findings with what is noted on a physical examination. In Lei's case, 2 ultrasound examinations did not identify any lesions. However, if one were to consider her clinical findings, one would see that the area where the lump could be felt correlated with an area with a different ultrasound appearance when compared with the area where no lump was felt, which had a normal ultrasound appearance. There weren't any classical textbook findings of cancer, but the subtle ultrasound appearance of some irregular edges, together with her clinical signs, made that part of her breast suspicious of cancer. So, in summary, in order to avoid missing breast cancer, we doctors endeavor to combine and correlate clinical examination with imaging findings and the results of other investigations. Each element in the clinical sphere should not be viewed in isolation. I hope this has helped you see how you can discuss your symptoms with your doctor and be wise in caring for your own health. If you have found the information useful, please like, subscribe, and join us in the next video. We wish you the best of health.